All right, Centenary Project back for another week. This is episode number 22, and we've got a little bit of a special episode this week. Our beloved Dr. Mike is out on the road and he's tuning in from his hotel. We thought this would be kind of cool to do this episode because one of the things that we do talk about from time to time is a pursuit of excellence. So, you know, we've made it known that we want to be people that are always trying to improve. So we're always chasing a level that we're not at, because that's how you get better, and that's how we provide more value, and that's what we want to always be doing. So there's a lot of different aspects to that. I guess one of the aspects is the reason why we do this podcast. In a sense, you know, we work on our communication skills. We catch up and we talk and we learn from each other. But one of the big obvious ones as manual therapists is working on technical skills. It's working on hand skills and getting better with that. And I think sometimes it might be surprising to people that there is so many different levels of skill in that skill. So there's a very high ceiling, right? There's almost a ceiling that we don't really know where it is yet, because as you keep training and as you keep improving, it keeps moving further away, which is a good thing. So I guess we want to push the boundaries with that over the course of a career and try to see where we can get to is the idea. So this, where are we? Thursday here, Wednesday there. So Mike's taken a few days out from clinic. He's on the road. He's doing exactly that. He's chasing down some new technical skills. So, Dr. Mike, give us an update. What's going on?
Yeah, I'm here in suburbia, Boston, Massachusetts. And first of all, I apologize if the audio or the internet is a little crackly. I'm using standard access hotel internet, and I don't have my beautiful setup that I usually do back home with my PC and a nice Bose microphone. So yeah, I'm here. I was looking to raise that ceiling. I was looking to get a little bit more proficient from a technical standpoint on a lot of the structures in the neck and upper back. And yeah, I paid a lot of money to be here, probably more money than anybody would ever consider spending on a continuing education or a training event. But like you said in the introduction, which I thought was a great introduction, it's not one size fit all, right? It's not one, once you learn this, you've got it. I like to, and again, how do I want to put this? The consequences of treatment like this aren't as high as, say, surgery, right? Where you make one wrong move and you've got some really, really bad, shit that you got to deal with. But from a technical standpoint, it's the same as surgery in terms of you can get better at it, in terms of there being good people at it and bad people at it. And you've got to work your absolute butt off in order to be one of those really good people. So, if you have any familiarity with the human body and understanding, the size of these structures, the shape of these structures, the fiber orientation of these structures, the pain pattern of these structures, anything in that, you have to basically boil that down into your decision and into the way that you go and you treat that structure. How do you tension rectus capitis posterior major versus how do you tension a rectus capitis, posterior minor? So there's a lot of work that goes into that. And, Chris and I, you and I think that we're pretty good at it, but we're not perfect. We're not even, I would say, in the top 50% of the people who practice like this. Maybe I think there's probably 60 of us in the world at this point. And, it feels great to be in the top 60 of 60 professionals out there. But, I want to get people better as fast as possible. And I know the way to do that is to refine the technique. And, it's not easy. It's like any skill. You got to repeat it. get coaching, repeat it, and you end up doing things wrong that you don't even know that you're doing wrong because you're in your own head all the time. So it's it's an interesting experience. It's been a beautiful day so far. We did 4 hours this morning of just the suboccipital muscles. We did the accessory nerve, and then, goodness gracious, what else did we do? We did one more thing that I can't think about. Oh, we did scaling, nerve roots and scalings. So we did basically an hour per structure, and we just repeated that and repeated that and repeated that until, not only did we get approval from the person that was coaching us, but until we got to the point where we were like, that was good. Like you could tell in your own head, I did a great job there, which is really, really important because, just like a cricket swing or a baseball swing, right, you've got to give yourself that feedback in real time and understand what went wrong and what didn't go wrong. And so does that kind of answer your question?
Yeah, absolutely. And you're doing small group training, right? So there's only like 4 people.
And one instructor. Yep.
So how is that experience different to like a larger sort of group seminar? Because a lot of that sort of, I guess, continuing education training is often in a larger group. A lot of the training I've done over the years is generally in a larger group. So I guess what you're doing now is much more focused and you're getting feedback just constantly on the fly. Do you find that's a much faster way to acquire these skills?
I don't know if it's faster. I think sometimes you need that big group setting and that kind of introductory level of knowledge in order to get a fundamental understanding of what's going on. And the small group is really where you're afforded the opportunity to take that next step where, maybe you need just a quick cleanup of your technique, and then it's about feel, right? It's what's that structure doing? How is it tensioning? Is it tensioning smoothly at a very linear and slow slope? Is it tensioning really, really high and then coming back down? Like, what does adhesion actually feel like? What does a healthy tissue actually feel like? What does it feel like when you actually reduce it, right? Like, one of the most important things is, like, I found the adhesion, I've done a treatment pass on it. What happens during the next treatment pass? How does that feel different from one way or another? Because at the end of the day, the doctor has to say, yeah, you have adhesion in your rectus femoris muscle, right? But then that doctor also has to know you no longer have adhesion in the rectus femoris muscle. And you can utilize tests to help guide you in that right direction. But at the end of the day, like, palpation is king, right? Feel is king. And you've got to develop that feel. We always talk about how range of motion is a blood pressure. It's a health screen. If we continue to utilize that analogy, we have to then look at palpation being the blood test, right? The range of motion lets us know that the range of motion of the blood pressure lets us know that something's wrong, but we don't really know what's wrong, and we don't really know how it's improving or if it's improved until you get in there and actually take the blood again. You will get a change in that big overarching test, but your triglycerides are too high. You can't instinctively tell that from taking blood pressure. And then you utilize an intervention and you see if the triglycerides come down. So it's just the feel of things is that next level. We love to measure. It's great. It's wonderful. And we've talked about this too a little bit. At the end of the day, it's the feel that matters the most. And it's just developing that sense of, this is healthy, this is unhealthy, this is how I know this is a good treatment pass, this is how I can expect this tissue to change moving forward. So it's just, it's I'd say the big group stuff is very elementary. And that's, I'm saying that kind of sarcastically because in the grand scope of musculoskeletal healthcare, it's not elementary, but in terms of what we do, the big seminars are, they're elementary, and it's like you've got to find a way to graduate from being robotic and just going, test is this way, perform the thing this way, and just repeat that 3 times, do that 8 visits, and pray that it's fucking better, to, wow, I just reduced that adhesion by 50% in 2 passes because I can feel it.
which is a pretty high level of skill, I think, right? Because not everyone's thinking about that either. Not everyone cares, unfortunately.
No.
But that's a really high level of skill to be able to have that awareness and to even be looking for it, I guess, really. I guess frustratingly, I've had the conversation with more than one practitioner that is not directly in this space, but I guess he's in the musculoskeletal space. So in a sense, they, still responsible for these problems. But on the surface, some of the work that we do, if you look at a short Instagram clip, it looks easy. It can look easy, right?
Mm-hmm.
And so the feedback that you kind of get sometimes is, and I've heard this directly, is that I don't need to have training on that because I understand where muscles attach. You shorten it here, you lengthen it here, that's it. And it's such a rudimentary way to look at it. And then, we talk about levels, right? And, I know I'm happy to say I'm at a baseline with a lot of this stuff and I want to be there because there's always room to continue moving forward. But, to hear the way that you describe that, it gives a real appreciation for the depth that's involved in this and, the levels that are there in terms of the way that you're thinking when you're approaching these treatments and what you're actually appreciating when you're palpating through the tissue. It's, it is complex and it needs to be.
Yeah, I'll give you an example from today, which, something that absolutely blew my mind, so to speak. And we're working on the levator scapula, just like really quickly at the end, just to get an idea of what's going on. And if you're familiar with anatomy, you know that the levator scapula basically runs from the medial angle down to the medial third. No, excuse me, not the medial angle, the superior medial angle of the scap, down to about that middle third of that kind of medial border, all the way up to the posterior tubercles of the transverse processes of C1 to C4. So you have a general idea of the direction that those fibers are going in, right? But you understand that structure is deep to the trapezius. So if you've got the levator scapula running this way, you've got the trapezius running at a different angle. So how do you know whether or not you need to go deep to the levator? How do you know it's not just a superficial adhesion on the trapezius? How can you go in there and feel? Do you have the skills to basically cross fiber palpate the direction of muscle fibers and understand, okay, the levator is moving this way, the trapezius is moving this way. So I need to know whether I got to go deep, whether I got to go straight up and down. And then it's as you do that treatment pass, it's making those micro corrections to go, oh shit, I thought it was a levator. Now maybe I'm going to come up and go down to the trapezius. So just simple things like that you don't understand. It's like, you can maybe get really, really big pieces of superficial, obvious adhesion, right, at a baseline level of understanding. But at the end of the day, it's like every time you put your hand on somebody, you're going through a list of things in your head. You're trying to understand what's going on. What way does that fiber go? How do I lengthen this tissue as much as possible? How do I lengthen it in a segmental way, in a way that my assistant understands and in a way that is slow and controlled enough? How do I set my thumb up in a position where the actual contact that's on that tissue is relaxed so I can actually get that proprioceptive feedback? How do I set my body up in a position to where I can literally fucking laser focus on my thumb and understand what's going on? It may seem easy, and as a physician, there are even days in the clinic where I'm like, man, that was an easy day. It was a great day. And there are times when I'm in there with a patient and we're having a good time and we're talking about shows on Netflix and we're getting great treatment, and it is easy. But that only comes because we've put in the work as a doctor-patient before that to actually understand what's going on, right? I've already got my X marks the spot. I know exactly where it is. I know how to reduce it. And, even if we're talking about South Park, right? I'm only talking to you about South Park with about 3% of my brain, right? If that, for real, if that. The other 99% is literally focused on my thumb. As creepy or as weird or as unusual as that sounds, like I can't shut that off. And I'm like, yeah, Cartman's funny, and I'm like, thumb, 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 thumb. So you've got to put the work in to get to that point. But once you can get to that point, you can almost become partially unconsciously competent.
Yeah, I think one of the things I wanted to highlight out of this chat today is that level of thought and complexity, because, I guess primarily kind of as soft tissue guys, that's mostly what we're kind of focusing on with this style of treatment that we're talking about. But, there is that perception that in our profession, at least, that's, soft tissue is just kind of like the crap that you do at the end just to keep them happy sort of thing, which is disappointing. But, there is such a depth of complexity in there to get the right result, and and you touched on it really nicely as well. You might actually get some good results for those, those easier cases, I guess, but then there's going to be the really tricky ones that are just not going to respond at all until you get down to those finer details. And if someone's not actually looking for that, who is? Like,
no one.
Yeah. Unfortunately,
and it might be the difference of a patient experiencing 70% relief and 100% relief. So that's a big deal, right? You go in and they've got neck pain that radiates into their traps. You say you do an amazing job of clearing the suboccipitals. You do an amazing job of making sure the rotation is good and the nuchal ligament's nice and clear. And you go in and you even clear that accessory nerve, which is easier said than done. And the patient's like, I feel great. And then you hear that magical word that like makes your heart sink. But I still get some pain every once in a while when I do this and I do that and I do this and I do that. And it's like, yes, it's amazing that you've got 70% relief, especially if you're an individual that's had chronic pain for 10 years and you can't find any relief anywhere else. And we go in and we eliminate that kind of first, second, third order stuff, right? The stuff that's taught at regular seminar, or the stuff that you could probably even figure out to a certain degree at an ART seminar, or in your soft tissue class at chiropractic college, which I would argue that you can't do shit. I mean, you're not going to do the suboccipitals at a chiropractic college class. Maybe you can hit the nuchal ligament with a tool work at a Grasses seminar, whatever. But sometimes it's that third, fourth, fifth order structure that you go in there and you change somebody's life. You've already changed your life, but you completely eliminate their pain. And that to me is an important thing to do, because not only do you change that person's life an extra 30%, but the person who's got 70% relief after 10 years probably going to go to a party and talk about you. The person that's got 100% relief after 10 years of pain, they won't shut up about you, right? It's like that. I don't know if they've got progressive car insurance in Australia.
No, I don't think so.
No, there's this commercial in the States where it's like, try not to talk about how much you'll save on progressive auto insurance for 30 seconds. And she's like, how's the weather? You can save 15% on your car insurance. And she's like, I can't take it. Like, that's the kind of person that you create when you get somebody 10-year pain, 100% fixed, and not worrying about it. So
we used to, I guess, say that about CrossFitters that couldn't shut the fuck up about talking about CrossFit.
Yeah, you're gonna turn somebody into like a cult follower of yours, which I don't not get into that, but yeah, that's how you get somebody to just not shut the fuck up about you, and that's good. But then it fixes their lives. It helps you become a better doctor. It helps you become more compassionate. It generates more revenue for you as a physician, and everybody wins when the doctor is really fucking good. Like, that's something that we always have to go back to, is everybody wins when the doctor is amazing. Everybody wins. If you want to make money, be a better doctor. If you want to fix the most people, be a better doctor. If you want to change the world, be a better doctor. If you're somebody that's pouring their heart out and is a bleeding heart, be a better doctor, make a lot of money, and then do whatever the fuck you want to do, right? From a social standpoint, right? You can give away a case for free when you've already fixed 1,000 people that year. You know what I mean? So that's really the key is you be a better doctor, and just let that trickle down to everybody.
Yeah, I think a take-home message from this as well is that this is hard, and that's that's a good thing. I think I appreciate that it's hard, because I think it's good to feel like a beginner a lot of the time, and I feel like that all the time. Every time I've gone and gotten that instruction, and with coronavirus doing what it's doing around the world and not being able to travel, I'm very fortunate that I've got a very experienced ID provider in Sydney, and I'm able to get coaching and training from him. And thankfully, he doesn't seem to mind me hanging around. I think he probably thought I was a fucking crazy person at first, but shout out to Dr. Marcus, you're a legend. But every time we go and do that, I just kind of feel, oh my God, I suck, and it's humbling, but it's awesome, because if you're willing to put yourself out there like that and take those hits, there's a lot of development and a lot of improvement that is waiting for you. And, that's where growth happens. So I enjoy it. I don't always enjoy it when you get that hit right there and you go, oh shit. But, you take away a lot from that. And, I'm looking forward to doing that for the rest of my career, because that's how we move forward. I'm sure a lot of people don't like to do that. They don't like to go to that level because they don't want to be told that they suck or they don't want to feel like that. But there's a lack of growth that happens when you don't do that, I think. And so if you can kind of be humble enough to suck that up and go and cop it, then there's good things that come from it.
Yeah, and I wouldn't sit here and classify myself as an expert by any stretch of the imagination. I think that I've just crossed the threshold from like beginner to maybe dipping my toes into intermediate at this point. So, I talk a big game. I'm confident in what I do. I'm confident in my ability as a physician, but in terms of the grand scheme of things, like I'm still freaking out and learning a ton at this point. I like to think of it as like, you're going for a swim in the ocean, right? First of all, it's really exciting when that water hits your foot. You're like, oh, I'm in, I've made it. And you're going down that kind of gentle pitch, and you're a beginner and you're getting wet. It's up to your chest. Everything is great. And then all of a sudden the C4 just drops. And you're like, oh, fuck, I'm not a beginner, but oh, fuck, look what I've gotten myself into, right? Like, I just stepped into that this morning where I'm like, oh, boy. Like, I don't know. I'm in outside of my, I'm in above my head right now, but I'm above my head in a good way, because I know I'm going to learn to swim. I know I'm going to, get some fucking scuba gear or something like that. And I know I'm going to be able to do it. So it's like, I just stepped off that sea cliff this morning and I'm like, oh, like now I'm getting to the point where I can start to feel things. I can start to understand some of those 4th, 5th, 6th kind of levels of understanding of some things. And then, again, try to get some people that maybe were only 90% better, 100% better, 80% better, 100% better, or even that person that was only 20%, getting them to 50%. So that's really what I'm thinking of, what I'm after. And yeah, if you had to rank me, maybe I'm, again, 40 out of 60 at this point. But it's one of those things where I'm excited. This is the one thing that I could, foresee myself continuing this profession doing. I couldn't adjust people or do this and that and not feel like I'd rather be uncomfortable myself than bullshit patients.
Which is an excellent way to wrap up this episode, I think. because that's what it's all about. So, yeah, man, I agree with you. I love the fact that, you know, you kind of dive into the water and need to learn how to swim, and that's how you move forward. So if you're in New York and you need to get some neck treatment, then he's your man. He's coming home with a new bag of skills. So there you go. All right, Dr. Mike, we'll be back next week, and make sure you enjoy the breakfast that's on offer at the hotel there while you're in, hey? We'll talk to you soon.
I hope so.
All right. We'll see you next week.